Story now. The KwaZulu-Natal Health Department is calling for calm as foot and mouth disease cases continue to rise in schools across the province. A total of 168 cases have been confirmed, with the eThekwini district accounting for 120 of these. All cases have been linked to primary schools and daycare centres. Since the first 6 cases were reported earlier this month, health teams have been visiting the affected schools in Phoenix, north of Durban, to investigate the growing spread of the disease. Newzroom Afrika's Phila Mthembu is now joining us live from one of the affected schools. Phila, very good morning to you. I can only imagine the concern from some of the parents, including the teachers as well. But what are you hearing this morning?
Absolutely, Aldrin. There's quite a number of concerns. I have been also engaging with some of the parents here as they made their way to school to drop off their kids. We are outside the Lenham Primary School here in Phoenix. Now, this is one of the schools that have recorded several numbers of cases. They have issued out notices to parents, just also, encouraging them to ensure that their kids are well taken care of and that safety measures are being followed as per instructions from the health department here in KwaZulu-Natal. But just to bring in Pam Naidu to speak to us, as she is also a grandmother to 2 children who are in the school. Thank you so much for your time. If you could first tell us about your concerns since the outbreak. I understand your grandchildren go to the school.
Good morning to one and all. I'm Pam Naidu. I'm talking in behalf of my grandchildren. They go to Lenham Primary. I just wish that they could close the school for a week, spray it, and tell us from where it came. And then when the first child enters, they're supposed to take consent of it. And then they should have sorted it out same time. Now our children are losing out on education. I would like the school to be sprayed and our children to go back to school. Because now there's no parents can go to the school without concerning. Everything is going on WhatsApp, and it's very hard. We are working class people, parents, granny, and my son is working, and it's very, very hard.
So when you say that you would like for the pupils to go back to school, because I do see there are actually a lot of children who are here in school, did you perhaps get to a point where you decided to stop your grandchildren from going to school because of the outbreak?
Just 1 or 2 days they stayed, but not all the days. Because it's very important for them to go to school so they can concentrate. That is why we send them to school. You see, on WhatsApp it's a little bit awkward for the child to see the writing. So I would like the school to consider this. When the first child had it, they were supposed to start from there. And then spray the school and...
Thank you so much for your time. That was Pam Naidu, a grandmother to 2 children who actually come to the school. Now, you will remember that the children are actually at a higher risk from actually being infected with the disease are those from 10 years and under. So you'd imagine, Aldrin, those are your grade 1s, grade 2s, and your grade 3s as well, who are at a higher risk. The Department of Health did say that they wish for stringent measures to be followed. I also did see quite a number of school pupils coming into the school today wearing their face masks as part of, their strategies to ensure that they do not get this particular disease. There've also been, though, concerns around the social distancing aspect of it, because they stand outside here and they regroup and they touch each other. We do know that this has been advised against from the health officials, but stringent measures are being called for, with the grandmother that you've just spoken to saying that they would like to see the school being fully sanitized in order for them to be confident that the disease, has gone away and that their children are also safe.
Thank you so much, Phila Mthembu there, joining us from outside the school with growing concerns from parents as well as teachers. But as you just heard, the Department of Health saying there's no need to panic at this particular stage. Let's take you to this story now.